Amidst growing concern of deaths among children and health complications posed by kidney problems in the Gambia, the Ministry of Health, with fundings from World Health Organization, on Monday, October 31st, held briefing on the ongoing acute kidney injury at Central Medical Store in Kotu. With the support of WHO to the Ministry of Health, 82 new confirmed cases has been revealed, in which 39 product syrups were tested on various countries such as Ghana, Switzerland, France, and only 4 products are contaminated. During press briefing, the regulatory officer of Medicine Control Agency, Tijan Jallo, said cough syrup has not been confirmed yet to be the leading death of all the 70 children that died of acute kidney injury, saying preliminary investigation has shown that some of them died without taking medication.
Due to this AKI, a lot of questions have been put to medications because there is a lot of panic going around the country. Most people don't have trust anymore in certain medications. But just to clear some of the shadow of doubt so that the general public will know, is out of the 70 kids that died, some of the kids died without taking any medications. And out of that 70 kids, some kids, they took medications that we have tested, and the medications are not affected. They are safe to be used, but the kids only took those medications and died.
He added that the World Bank is supporting Gambia government and step has been initiated to establish quality control laboratory. Focal person of Medicine Control Agency Lamin Sambu highlighted symptoms of acute kidney injury in children.
Usually a child will urinate up to 2 or 3 times or 4 times in a day. We know how active children can urinate. But if you sit down and then see that your child has not urinated for a whole day, even an adult, usually you urinate up to 2 times in a day as an adult, let's say from morning to afternoon time. But if you stay for more than 6 hours, 7 hours, you don't urinate, you feel uncomfortable. And there's usually that pain around the lower abdomen, and this is usually very frustrating and very uncomfortable. So imagine a child not being able to urinate for 24 hours. You can imagine the excruciating pain they were going through when they had this condition. So another signs and symptom is the swelling of the legs, the ankles, and around the eyes. So these are the advanced stages of AKI. Once AKI is confirmed, the swelling of the legs will occur, the swelling of the other limbs, the swelling of the eyes, and then also you will observe shortness of breath.
Meanwhile, Mr. Sambu also elaborated on steps taken by the Ministry of Health to respond to the acute kidney injury which resulted to the death of 70 children.
What actions have you taken as a ministry to contain this outbreak? We did a lot of communications. A lot of messages went out to the people to avoid these medicines, to go to the health center, if the children are sick, so on and so forth. We also banned the importation, the sale, distribution, and the use of paracetamol syrups, cough syrups, and then promethazine syrups. So promethazine syrups and cough syrups were the ones found to be contaminated, but we don't want to take chances. That's why we are expanding the ban and the recall to paracetamol syrups and all other medicines that were found to be and all other medicines manufactured by Made in Pharmaceuticals. We've also done a medicines recall exercise 2 times, and we have really recalled a lot of medicines. Yes, still we will go back to ensure that all medicines that are suspected to be recalled from the households. What studies are we doing right now? Currently, we are doing a lot of studies. One of them is a causality assessment. Causality assessment will be able to tell us what is the actual cause of this AKI. Right now, we are acting on hypotheses, but we have to test those hypotheses to actually come up with a conclusion to say that this is the actual cause. So we are calling on the general population to be patient with us until we are done with our studies.
In West Africa, kidney diseases are frequently seen, but diagnostic and therapeutic options are poor due to limited access to specialized facilities. Reporting for M24, I am our MCC.